and today we have our patient who's getting a lower face and neck lift next week, and I wanted her to share her story as to why she decided to proceed with the surgery.
Yeah, well, one, I wanted to look more refreshed, and I thought doing it a little earlier in life might be better than later, because it won't be maybe as noticeable to people. The other thing, I started wearing readers. And I looked in the mirror with the readers on one day and thought, this would be kind of nice. And so I just thought, this is the time.
Excellent, excellent. Well, she brings up that one maneuver all patients do, which is this right here. And really, that's our goal. We want to create shape, just like we do elsewhere in the body, but more particularly create that natural jawline and really help recreate a nice angle to the neck. And you're a great candidate for it, and we're going to share her story and surgery with you guys as we get ready for next week. Thank you. Walk you guys through a couple things that we notice on exam that are important when we try to plan the operation, as well as to kind of get her thoughts about what she's excited about, what questions she has leading up to surgery. So first of all, what we notice is you can see here that she's got skin laxity in the neck, and it creates these lines, which are the muscles of the platysma, the muscle edge of the platysmal muscle. And so what we're going to do is we're going to treat that for her. We're going to sew that muscle together to recreate more of a right angle to the neck, and then we're going to redrape that skin. Now the key is you want to use the appropriate vector, meaning you want to bring the skin in the right direction to help recreate a contour to the jawline that looks natural to her, okay? Additionally, you can see she's got some jowling here, and what that does, it creates a shadowing here called the pre-jowl sulcus, a little bit of what we call a witch chin deformity, okay, because you've got rotation of the jowl coming down. And so our objective with the SMAS procedure is to take that tissue and reposition it. This is going to create a little bit of cheek volume for her and really help to recontour that lower third of her face. Now, Sheila, tell us a little bit about your questions about surgery. What are you concerned about? What are you excited about?
Well, I'm excited about the result because I'm confident it will be a good one. Nervous about the anesthesia and just sort of the risks that go with that, but your staff has been very helpful in putting my mind at ease on a lot of it. And so right now I'm feeling more excited than I am nervous about anything.
Excellent. Well, she brings up some good points. When patients come in for consult, I get asked a couple questions. Number one, tell us about the procedure. Okay, what's unique about this SMAS facelift and the anesthesia? And I tell patients there's no shortcut in facial aesthetic surgery. Okay, there's certain maneuvers that we have to do, and predictably, usually the time is about the same for each maneuver. But you combine that, it does take time to recreate the shape that we want to. But I just don't want a shortcut anywhere, and so I know what my time is. We have found that based on the literature, in cosmetic surgery, anything less than 6 hours doesn't really carry an increased risk of general anesthesia issues. Obviously, there's a risk with any surgery, but the safest place, in my opinion, to be is in the operating room with them asleep so that we have a nice, calm, sterile environment because we're operating around very important structures in the face. We have good control of their airway and their vital signs, and then we just take our time to get it right. We get one good shot at it. Once you create scar tissue, it becomes harder, and so I want to make sure we do the best job that we can and try and get it right the first time. The other thing is they ask about where the scars are, right? And the scars are going to be located in the sideburn, and then we tuck them into the ear and back behind here. And the scars are necessary, but we spend a lot of time in surgery on the scars to try and make them look as good as possible and concealable, but that will allow us to get rid of that excess skin. Anything else?
You answered it with the scars. That
Yes.
was one thought. And no, I just really feel confident about it all. I'm really looking forward to it.
Excellent, excellent. Well, we're excited for you, and we hope you guys follow along as we share our story. Thank you. Good morning, everyone. Dr. Surek here from Surek Plastic Surgery. And we have our patient today, who's our patient story for a lower face and neck lift. How are you this morning?
I'm good.
Good. Are you excited?
I am.
Excellent. So just a reminder, today's goal, okay, she's bothered by this excess tissue in her neck, okay, as well as the jowling. So our objective today is to reshape and recreate the lower face and neck shape for her. She also brought us a photo of herself 10 to 15 years ago that I'll keep in the operating room with me, and I'll look at that to try and help us customize the shape recreation, if you will, for the lower face and neck. looked up, we can see that she's got these bands here and this loose skin. So what I do is I mark the band on each side, and then I can see where the crease of her skin laxity is, and I'll carry that out along the neck here, and along the neck there. And this reminds me to make sure I undermine in those areas. I also mark where the jowl is on both sides. Turn towards this way. And then I'm going to mark along the cheek where I hope to get movement with skin elevation. Finally, I'll come back behind here, and we're going to hide her incision in the temple, and we're going to carry it up like this and hidden back behind the ear. And then we'll take this up here and go that direction. And you can see where the crease is. This is where we're going to hide it and carry it back down onto the hairline. Thank you. Good morning, everyone. Dr. Surek here from Surek Plastic Surgery, and we have our patient story, our facelift from last week. How are you doing?
Fabulous. I just think it's amazing. You do beautiful work. I told them I'm looking in a mirror with a magnifying mirror to try and find the stitches. I can't see a thing.
Well, that's great. That makes us very happy. So a lot of people ask about recovery. Well, you can see she's about 5 days out and a little bit of bruising and swelling, but not a lot. You can already see she has a nice shape to her lower face and neck. And the good news is that the swelling will continue to subside over the next week and really take form and shape on the lower third of the face.
Yep, it's great.
Awesome.
I love it. I was saying to him too that instead of looking in the mirror and wishing I was doing this, I'm now looking in the mirror and just thinking how much I love it.
That's awesome. All right, we'll keep you guys updated. Thank you. Dr. Surek here from Surek Plastic Surgery. We have our patient. She had her facelift last month, and she's doing great. And later this month, we're going to do the finishing touch by working on the eyes and the brow as well. First of all, let's just see, this is her original photo here. You can see we had banding, we had jowling, skin laxity, and now we can see she's got a nice, clean, natural-looking jawline, a right angle to her neck. The banding is gone. Her incisions are healing very well. How do you like it so far?
Oh, love it. I just saw that picture and I said, oh my God, that's horrible. No, it looks great. I'm thrilled.
Awesome. So she's doing very well. And stay tuned. In our next video, we're going to show you what we're going to do for her brow and her eyelids. Thank you. Hi, everybody. Dr. Surek here again. We've got our patient who we did a lower face and neck lift on. And now, as I mentioned, we're going to do the finishing touch. At the end of this month, we're going to work on the upper portion of the face. The first thing we're going to treat is she's got this puffiness in her lower eyelid. We can actually do an incision on the inside of the eyelid to remove that fat, take away the puffiness. And then she's got this crisscross pattern and pigmentation. We can utilize a chemical peel to help correct that for her. It's very important that we put her on a pre-peel regimen to get her skin prepped up. Additionally, you can see that she's got some lateral brow ptosis. So what we want to do is we want to give her a conservative but effective lift to bring that lateral brow up to a more desirable position. And then we'll be able to remove the excess skin in her lower eyelids. She's an excellent candidate for this. Are you excited?
I am. I really am. It just will complete the package.
Absolutely. Yeah. So stay tuned as we show you her results. Okay, so what we see is if we come down here and look, we can see this lumpy, bumpy shadow and jowling along the jawline. And as we zoom in a little more, we can see what we call the obtuse cervical mental angle. In other words, this excess skin and fat that bothers her and lack of definition. Then as we come over here, we can see a very clean, natural jawline. Notice how her jowling is gone, and notice the more right-angled appearance of her neck. That's because we spent focused time on removing the fat here, tightening the muscle, and then redraping the skin to give her a very natural look.